We wanted to bring a more advanced echo imaging technique called left ventricular global longitudinal strain into our echocardiographic lab everyday practice. GLS is a sensitive way of measuring how well the heart muscle is squeezing, the function of the heart. And it actually can help us because it catches some early signs of trouble before they show up on our standard measurements. The challenge is that our echo lab here at Palos was not yet using GLS routinely in our lab. And so our goal was twofold: to include GLS into our everyday workflow, and then also to make sure that we were performing and interpreting GLS images in a high quality level.
The lab that we worked with was the Palos Echo Lab, and they were doing some strain imaging, just not a lot. There were very few of the sonographers there that were using it. But we were able to look at the studies that they had been doing so far just to get a baseline of where they were, what they were doing, who was doing it, how they were doing it, and how they were interpreting the images. We then created 3 educational videos on how to do strain imaging, how to incorporate strain imaging, how to interpret strain imaging, and then a series of cases to illustrate our educational points. Those were on demand. We placed them on a team site so that every sonographer and every physician had the opportunity at their own time to be able to access the videos.
We paired those videos with some auditing and feedback. So a group of experts reviewed samples of our scans and scored them against a checklist. And then they shared the results with us directly, with the sonographers directly, and with the physicians directly. And we did this audit and feedback process 3 times over the course of about a 5-month period. And after each round, our team adjusted on the feedback and improved significantly.
It really came out to be a very positive experience because now when you see the studies done over at the Palos Echo Lab, they're excellent. They're doing strain imaging just as often as any other lab, including our lab here in the downtown campus. The quality is excellent, and we don't feel that we added any kind of burden to their work by incorporating this into their protocol.
Palos is now not only using global longitudinal strain routinely, but also other technologies very routinely on appropriate patients. And we're doing it at a high standard. So when you're referring patients to get their echoes done at Palos, you should be confident to know that they're getting the same advanced sensitive echo imaging just right here at home, close to their homes and in this community setting, rather than having to go to a big academic center.